it, especially now it needs to deal with this monumental backlog of cases. There's a huge elephant in the room there because all this tinkering about, I don't know, whether it's reform this and manager numbers that, we're about to lose potentially tens of thousands of staff. So if I was Sajid Javid, I'd be focusing on that first, but probably a good job for the country that I'm not the Health Secretary. Alan Miller, you run Together Declaration. I know you was at Parliament, actually. Was it yesterday?
10 Downing Street to hand in the petition of 200,000 people saying Together Declaration, an end to vaccine passports, and 160,000 saying an end to vaccine mandates. And we had a lot of representatives from the NHS, doctors, paramedics, nurses, that were all...
Oh, there you are. For those people listening and not watching, you're seeing the lineup of them outside 10 Downing Street. Alan in the middle there, looking very dapper indeed. Are you wearing the same jumper, by the way? Have you been
Michelle,
clear? Have you gone home?
I'm like the fly. You see, I have this...
Sorry, I shouldn't pull you up on that.
I have about 8 of the same blue jumpers, but I'm glad you asked because I was thinking...
You're like Steve Jobs. You same top. Anyway, sorry, I do digress on what is a very serious topic, so please carry on.
I think, well, there's a couple of things. I think that, you know, as it happens, academies can be really good, and some of them are really high standards, and we see really excellence. A lot of inner city kids going to Oxbridge, and they have high levels of achievement, and there are lots of ways to organise schools, I think. And the thing is about this question is that there's a number of layers. One is that you've got brilliant frontline workers, but there's a real issue with bureaucracy. The public-private partnership was a bit of an unmitigated disaster, you know, in the sense that it cost much more money, it didn't get any more efficiency. I think the idea that we've got a 95,000 shortfall of NHS staff at the moment, understaffed, and then to threaten 126,000 staff that have bravely served for 22 months since the start of it, many of which will have had COVID and have got high immunity, higher often than people who've been vaccinated, and to then threaten them that they're going to lose come April the 1st their job if they don't get vaccinated, if they're mandatory vaccination, is absolutely outrageous, and that's obviously why we do the Together Declaration. But I think so that's it's a ridiculous moment. The 6 million waiting on the waiting list and over 300,000, you know, these numbers are really frightening. And that's as a consequence of the policy of lockdowns. That's not because of a pandemic. There's a specific policy of lockdowns that have led to a situation that we now face, that there was always going to be a reckoning. And I think that, you know, people talked a lot about unprecedented things. We should have never done the unprecedented lockdown. We should have protected the vulnerable and the old and people with high risk.